What does it mean for a child to care for a parent with cancer? How do you balance caregiving responsibilities without neglecting your own well-being? And how do you find answers when met with so many unknowns? Hi, and welcome to Kidney Cancer Unfiltered, a podcast by the Kidney Cancer Association, where we dive into the raw stories of kidney cancer patients and survivors. I'm Anna Maria Scaccia, your guide through the unfiltered experiences that often go untold. Our guest, Alysse Bobo, has not only faced these questions head on, but emerged as a passionate advocate for other caregivers. In this episode, Sarah opens up about caring for her now late father as he battled advanced kidney cancer, and the memories that continue to bring her joy today. Sarah also shares the strategies she used to communicate with her family and with her father's care team, how her age influenced her caregiving experience, and the importance of practicing self-care while caring for a loved one. We also explore the challenges of life after loss and how to find healing in yourself and in others. Whether you're a caregiver yourself or want a deeper understanding of the caregiving experience, you won't want to miss this episode. Stay tuned for an intimate exploration of love, loss, and the strength that comes for caring for another. Well, thank you so much for joining me today. If you can, just give our listeners a bit of an intro into who you are, what you do, and how you're connected to our community.
Yeah, so my name is Alysse Bobo. I am a stress management consultant, and I got involved with the KCA because my father actually lost his life to kidney cancer. And since then, I've been looking for ways to A, educate myself, and B, help the community out, because that was something I wish my father would have had, but it happened so quick. So I wanted to give back and also learn.
Thank you. And I'm so sorry for your loss. And I send you hugs, virtual hugs. I would love for you to go deeper into, I guess, your relationship with your father and caregiving, because I know that that's the topic for today, or rather to our listeners, that's the topic for today is caregiving. So I'd love if you could just talk more about your experience with that, with your father, and maybe outside of that too.
Yes. So my father, he was an incredible man. If you would ask anyone, whether on the street or a coworker, any interaction they ever had with him, he was just a delightful man. But he got so sick within 2 months in 2016, January 2016. And it was interesting because from diagnosis to death, it was 2.5 months of us not really knowing because it metastasized so fast, which meant there was a lot more that they needed to find out over time. And when you do the research, it probably was going on for a little bit, but it doesn't show up. So
yeah,
that was very difficult for my mom and I because it was so sudden. And, you know, he seemed to be doing great, and he had recently lost weight and he was taking ownership of his health. So it was honestly a surprise to us. But with the caregiving, my mom was more in the caregiving role, but I had to take on kind of different tasks. We had to divide and conquer, which I felt was something I really learned about. And for me, I had to kind of be the communicator with family members and friends of what was happening and going on. And my mom was there with him day in and day out, you know, just trying to make sure she was there for him and hearing what the doctors, you know, were doing and how we could make his time. We thought it was more than 2.5 months, but we found out it metastasized. So we just wanted to make sure during that time he felt comfortable and that we could be there for him. But we also had to take care of ourselves too, which was probably the harder part.
Yeah, and thank you for that. And there are a few things I want to touch on from that answer. I think the first one is, you know, this concept of dividing and conquering. I think that sometimes, and I think this is an educational moment for people who are going through the illness, who are going through cancer, and really understanding the caregiver journey. I think there may be a false perception, if you will, that it's kind of like caregiving is just like this kind of one note experience, when in fact there's multiple layers to the way one can caregive. So I would love for you to just go more into that. Kind of, how did you decide to divide and conquer? What did you decide to take on versus your mother? How did you come together? And we can go from there.
Yeah, my father, he was one of those bright, sunny, warm people, but he also was a nurturer, and he wanted to be in charge of everything for himself because he didn't he didn't accept that he was dying, and we were very happy about it because we wanted him to stay, motivated and fight the cancer. But there was also some realities that, hey, let me take some things off of your plate because you shouldn't have to be doing all these financials by yourself right now. You need to focus in on the care. And with my mom, I knew that continually talking about this every day would be draining. So, with that, because I also lived in a different state, I was able to drive home for the weekends and maybe stay a couple of days during the week. But during that time, I was like, I'll be the one that communicates. So if you could just share with me, mom, details about the plan, what's appropriate, when can people visit him, how often my father would actually like that. We did make sure to ask my dad what his needs were, because that's probably the worst thing that you could do to someone is kind of force what you want. And so that was something my mom and I had talked about. We want to make this easy for us, but also be very compassionate of what my father's needs are first. And that's ultimately what we decided. And we kind of created, you know, different times that really worked with my dad based on his feedback. And then we also, delegated time when I would communicate because it was a lot for me too. So, yeah.
There's like a beautiful balance in that, right? Like this recognition of what your needs are, but also understanding that the person you're caring for is going to have needs too, and just trying to balance that dynamic so that everyone has, it sounds, I guess, maybe bad to put it in this way, but the easiest time in a very, very challenging situation. How did you take care of yourselves? I love the fact that you knew this about your mother, that talking about it every day would just be too draining for her. So you're like, this is how I'm going to step in. Talk more about that communications, that like recognition of what works, what doesn't work, and how you met those needs.
Yeah. So at times, honestly, I had to be firm because my parents also, the reality was, I don't think their will was up to date. And so
Mm,
I had to step in and say, hey, this is something we probably should take care of regardless, of dad being sick. Like we should just have a game plan. I also come from an interesting background. I'm in musical theater, but in college, I took a class called Death and Dying because I'm an only child. And I
mm,
felt like this was, and I also took peace studies, but the Death and Dying course really helped me as an only child be able to, if a circumstance would come about, I knew a little bit more of how to deal with it. And there was a couple of things that they kind of gave you as checklists. And that was one
mm.
of the things, but I would have never probably thought about that on my own. So that was a tough conversation. I said, hey, when was the last time this was updated? And then my mom was like, okay, I'll start figuring that out, And then we had to figure out other things, plots. And that's never a
Yeah.
fun conversation.
Nope.
But we really tried hard to also be mindful that both of us were kind of struggling. And so we would do little check ins with each other over the phone. For me, I am a big advocate of self care. And I'm a Pilates trainer. So I would take myself on the equipment at least 3 times a week to get myself moving and recharging because the conversations were very, very difficult, especially with certain family members. So I had to relax myself prior to those conversations.
And I wanted to ask, what were the ways that you took care of yourselves? You know this as a caregiver, and I myself have been a caregiver before. It's really important that we, as they say, fill our own cups, right? And really make sure we take care of ourselves so we can give more to the ones we love. So, other than, Pilates, how else did you and your mother take care of yourselves to make sure that you were in a good centered place to continue?
Yeah. Well, my mom, it was more so making sure I had to do check-ins with her to make sure she was getting food, or like just showing care and showing that we cared about each other and the check-ins. And for her, I wanted to make sure she was still eating because I know she was spending a lot of time at the hospital. And for me, I was taking the fitness care, but I needed to do something like watch a movie to make me laugh, or get on the phone with my dad and talk and have more like fun conversations that weren't involved with his cancer treatment plan. And that kind of lightened the mood and also just kept us, you know, feeling good throughout that time too. I have some happy memories during that time because we were having great conversations. He's a diehard Packer fan like me, so we would watch the football game and chat about that, and little things like that really helped during that time.
I love that. I think that brings up a really good point about how I think something we forget when we're in the throes of of a disease, of cancer, of an illness, to not make that illness our personality, right? Like we can't ignore that we're going through it, or that our family's going through it, or our loved ones going through it, but we can't also, get ourselves lost in it. So I think finding those beautiful moments of joy with your father, that's so great. I think, what are some other things you touched on? The education aspect, right? The death and dying course. What else did you do to educate yourself? Because that caught me at the beginning of when you were talking about it came on so fast. Like he was probably there for a while, and then all of a sudden, like it just went off. And that's true of kidney cancer, right? Like it really does not show up to the later stages. So how do we prepare? Like, how do caregivers prepare themselves?
That's the hard part, right? I don't know
Yeah.
if there's anywhere way to prepare us. Like I said, I had that one course, and then I researched all that I could about kidney cancer. But as you know, there's all these different types that you're
Yes.
not even
Yeah.
aware of. And then I'm like, well, is it this one or that? And they're like, oh, we're not sure yet. And I'm like, well, that doesn't help. Like, and I'm a problem solve person, a
Yeah.
little type A. And I was like, no, I need to figure out, like, should I get him green juice every day? Does he need a burger? Like, more protein? What is it? I was trying
Yeah.
to figure out how I could help him in any way possible. But the truth was there's no right answer. So I just, I had to dose myself with optimism and try and dose my family with a little optimism, and also understanding that it is out of our control in some regards, and understanding the different aspects of kidney cancer and what could happen was helpful for me. But honestly, I didn't learn as much as I know now about kidney cancer when my dad was alive, because it was almost soul sucking at that
Mm.
time because there's so much.
Yeah, I could imagine. And I think from that, for people who are listening who may have a loved one who maybe just was diagnosed with cancer and a couple months in, maybe even a couple of years in, it is soul sucking, right? Sometimes when you're in the middle of it, you can't. What would your advice be to work through that? Now that you can reflect on it, you've learned, you've studied, you advocate, what would be your advice to those caregivers who are kind of going through the same thing? It's like, I don't know, this is just too much.
I'd say the one thing that I don't want to say regretted, but I wish I would have been a little more proactive on, was understanding the different trials that were out there and just knowing all of my options versus assuming that the doctors my dad was with was 100% correct. Like that there was only two possibilities, and
Mm.
then once he got to a certain stage, there was no possibilities. I wish I would have, like, that very first week that we found out, kind of done a little bit more research about those clinical studies because there's a lot more out there, even more than when my dad was alive with us.
Yes, that's true. And I think a lot of, in my experience, I think a lot of people don't realize that clinical trials are a way to go unless it's like really dire straits or close to dire straits. I think, and this has nothing to do necessarily with caregiving or cancer patients or survivors themselves, but I think in the medical world, there's this idea that like clinical trials are only for the select few, that maybe you don't even feel like you deserve to even be a part of it. So I think you even bringing that up is a reinforcement, if you will, for both caregivers and patients and survivors, that to look for them, to read them, look up for them. You make sure you know all of your options. Don't assume that these options are not for you. Look up as much as you can and educate yourself as much as possible within the energy that you have to, right? And with that, who did you turn to? Other than your check-ins with your mom, who did you turn to when it just got maybe too much?
I am very grateful that I have dear friends that were there for me in a heartbeat. And I actually just sold my fitness business, but all of my clients then, and I'm still extremely close to them now, all of my clients did things like they said, we don't have to have a session, or they got me a train ticket home because I didn't have a car to drive to Wisconsin and back constantly. So they would do these like small little things that meant the world to me and just showed that they cared. And they would also send food and ask if there's anything or talks on the phone. And I was amazed by the support system that I had. And that continually inspired me also to like take take responsibility and take action when my dad passed and figure out how can I help other caregivers, because that was extremely important to me too.
And that leads into my next question about caring for the caregivers. What are some ways, and you mentioned some through what your support system did for you, but what are some ways that we can care for caregivers, whether we're the patient or survivor ourselves, or someone who knows a caregiver? Like, how can we help that journey be a lot less daunting, if you will?
Yeah, I think for the patients, for them, I'd say make sure you ask your loved ones for help, because sometimes they're afraid to ask because they're worried how that might be perceived, or if they need a little space because it's just they're tired all the time. Don't be afraid to say something, because your loved one will do anything for you because they love you, right? And for caregivers, same goes, like don't be afraid to share with people what's going on. You're not a victim. This is not, you don't have to worry about people thinking that you're always going to be asking for something. This is a big deal. What's happening to you is a big deal. And you have helped so many other people that you don't even probably know it. And so it's your turn to get a little help as well.
Of course. And communication is such a vital component. I feel like, I don't know, as a society, as a group of people, we just can't, whether or not we're survivors, caregivers or not, we just can't get the communication thing right. But it's such a vital part to everything, especially when it comes to caregiving. So you had talked throughout about communicating check-in. Can you talk about like some tactical ways that you've communicated, or avenues you use to communicate?
Yeah. So designated times was a huge one when, hey, you can call me from this time to this time every Thursday. And please, if I'm not picking up, just text me and I will get back to you during that time. So that was very helpful. And or scheduling, if those times didn't work, scheduling specific times with people so that they could get all the information. The other thing that really helped was making kind of a spreadsheet of, what appointments were happening, where, my mom needed to be, where I needed to be, what my schedule is like, so we could communicate with one another, and then passing it to people that also were helping us a little bit with that caregiving part. But for the most part, it was just my mom and I. So we just like really needed to communicate, and communicate. So those two were probably the biggest ones that we consistently used. And like I said, I felt that this was important. Always talking to my dad, checking in with him. If he was tired one day, making sure at least every other day I was, hopping on a call with him, even if I couldn't physically be there.
Now, what about the medical team? So, one big part of caregiving, as you know, is really being involved in the care and making sure the care is going smoothly and stepping in when the patient themselves maybe doesn't have the energy, doesn't know what to say, maybe is feeling, insecure about how to advocate for themselves. What are some ways that you became part of the medical journey for your
My
father?
mom honestly did an excellent job of this. I felt she got to know every nurse, every care worker that, maybe during the rehab, because he had to go to a rehab facility for a little bit too. Every doctor, my mom like would learn a little bit about them, one little fact about them, and ask about them. And honestly, that tiny bit of a difference just by simply asking about the provider, or the caregiver, not the caregiver, the medical team, a little bit about them. Like nurses kept, my dad, like I said, is amazing. And so people would always come in and chat to him because he was just a sweet, charismatic guy. But my mom was the one that I think if she wasn't there, there would be a nurse checking in on my dad because my mom took the extra step to get to know people. And I owe that all to her because, regardless of what the cancer, my dad had people always checking in. Our regular doctor, our internist, he came in and checked on my father, biweekly when he was at the hospital. And just having those connections made such an impact on my dad's healthcare. So it really did make a difference. For me, I would just learn who the head nurse was. And because I was not living in, I was living in Chicago, I just wanted to find out because then on my own time, I could educate myself on certain things that were going on. Like, oh, it's renal cell is what they discovered. Well, let me see if there's anything I could find that may help my father without like overly pushing him or making him feel like he doesn't understand something, just having an understanding on my own terms was very helpful. And that way I wasn't interrupting the process of his care, but still learning on my own.
That's, I think, something that we all, even for ourselves, like we all just kind of need to double down in is just educating ourselves on that process. What advice would you have, though, for caregivers who maybe feel not so secure in gaining that education, not knowing where to go to, or maybe, unfortunately, doesn't have a good medical system that they're a part of or a, good doctor? Because unfortunately, that is too common for a lot of us of having poor healthcare. So what would your advice be for caregivers and kind of circumventing that or navigating that?
Totally. And I do feel that there's not a lot of good bedside manner when it comes to like when the diagnosis was read, I was, oh, this is not how you're talking right now is horrible. And I could only imagine what was going on inside my father because I was tensing up and feeling all sorts of horrible profanities. And I wanted to just, so my whole thing would be to make sure that you use the KCA resources because at the time I didn't even know KCA existed. I'm so glad I know now because when I have ever had a friend or a friend's family member that shared with me, hey, there's kidney cancer now. What do I do? There's so many references on there. So I'd start there. And then, as horrible as it may sound, but these people are in charge of your loved one's care. So sometimes you have to act just a little bit, and kind of what my mom did in a very curious way, just get to know something about them. Because if you can relate to them human to human, they might provide a little better care. And it's unfortunate because they should just be doing their job, but sometimes that makes a difference.
Yeah, I mean, it is a high stress environment, right? And it's about breaking down those walls and that, like you said, human to human connection. Now, I know you had said that you are doing work to help other caregivers. So talk more about that work. How do you advocate for other caregivers today?
Definitely. I have created this soul system for people so that they can focus in on themselves, to create solutions for whatever is going on in their lives. So if they are the caregiver, a lot of the time we don't take care of ourselves. And I had some of the tools, but again, I didn't have the tools like I do now. And so it's just simply self-care, optimism, understanding, and lifestyle. And during the time of things that are going maybe off the rails, it's so important that you check in with yourself. Ask your soul, like, what do I need right now? And it's usually one of those four things. I need a little self-care. I need some optimism. I need to understand. Maybe journaling something down might help. And then, I need to focus on my lifestyle, because that's something I can control, because I can't control everything else.
I love that so much. I think that, checking in with yourself, not only checking in with other caregivers in your family, but checking in with yourselves. We don't, no matter where we are, what our label is, and whatever is going on in whatever situation, we don't do that enough. So, and I think having it broken down in those 4 areas, I think it gives you kind of that focus of knowing where to check in. Because sometimes it's just a matter of, I have no idea where to start. Right?
Yeah.
Like, I don't know where to start. I don't know how to articulate how I feel. I don't know how to articulate my need. But kind of having that system that you were talking about, that you created, that soul system of, okay, here are my 4 areas. Let me check in. Let me see what I need. What am I missing? It gives you a place to start. And I think it allows you to show up better for yourself and for others, I would imagine.
Yeah, definitely. And, something I've noticed, because a lot of my clients have gone through, like my health coaching clients, they have really gone through a lot of changes, life changes, parent loss or parent sickness. And then maybe they're having a baby, and there's so many things that start to come up. They're like, how can I do it all? And I'm like, really, in order to take care of the people you love, you have to check in with yourself, because if you can't take care of you, it's kind of like that, the cheesy image that they always say, you have to put your mask on first before helping others.
Yeah.
But it's so true. We have to take care of ourselves so that we can best serve others.
Yeah. And I think, unfortunately, that phrase, that phrasing, or that the concept behind it gets such stigma around it, because it's this idea of like, you don't want to be selfish, but it's like, at the same time, it's not about necessarily about being selfish. It's about having that energy. And I think it's also the way in which you do it, right? Like, there's a difference between going to the person you're caring for and making them feel bad about the fact that you have to care for them. And then also, different from finding a way to take care of yourself so you can show up for them, right? It's all, again, communication, managing those relationship dynamics. And, we don't all do it perfectly, especially if it's something new to us, right? Like, we're not going to do it perfectly. But I think, it's really understanding how you show up. So what are some other pieces of advice that you may have for caregivers? I think since your father had passed away, you know, I don't think caregiving stops, right? There's a memory that you keep alive and that you keep close to yourself. So for those who have lost someone, what are some ways to take care of yourself after that moment, right? After that point in everyone's lives where, you know, there's that transition.
Yeah, I don't remember who told me this, but every day, every month, every year is different. So you grieve differently. And you go through those 7 stages of grief, but they can sporadically come back whenever. And the first year we wanted to celebrate my dad's memory. So the first thing we did, my mom and I took a trip that we knew my dad would love to do. He loves sitting on the beach and occasionally, going out and seeing something in that city. So we did a trip to the Dominican Republic, and we got a beautiful swim up pool on the close to the beach. And it was honestly, I felt his presence. That was like the first time I felt his presence there, just being on the beach, doing something he loved, reading a book. And that was something I'll never forget because my mom and I did it together, and it was in honor of my dad's memory. So that was a real treat, and something I'll always remember. Another thing was for my husband and I got married in 2022 of the fall. And something I'll never forget is when we were preparing everything, getting ready for the ceremony. In the Jewish tradition, there's a thing called the talit, and it's a prayer shawl. And what I wanted to do was have things of like my father with us. And it felt like my dad was giving Evan and I like a big warm hug on the day we were getting married. And because they put it around us, and his father was on one side and my mom was on the other. And it just was one of the most magical feelings that I could possibly have. And so keeping their memory alive with something that you have of theirs, sharing stories, passing it on to generations to come, like those things are what matter the most. And you might grieve in a different way. You might be angry one year, and give yourself some grace because that's going to happen too.
First of all, that is just amazing. And I feel that in my heart. So that's beautiful. But the example you gave about doing something you love, I think about my father had passed away in 2016 too. And one thing my sisters and I do sometimes, especially around the anniversary when we can get together because we're all in different states, is we'll just make a salad and get a rotisserie chicken. Like we're Italian, like we're full Italian. We made Italian meals, but like, you know, my parents divorced, and when we would get together with my dad, that's what we did: rotisserie chicken and a salad. And that's like the first couple of years. It's like how, you know, we honored him. Even to this day, it's like that's kind of how we honor him. And I think that is just a beautiful, touching story, because I think we forget that sometimes the ways we honor is just by fulfilling. It's not, you know, about having all the pictures or, you know, putting out a, you know, Facebook post. It's just about those little things of like, hey, let's take the trip that they always loved. Let's do this for us, right? It doesn't always have to be public and, you know, whatnot, if you will.
Yeah, that's such a good point. I feel a lot of people get so nervous every year. Like, is this post going to be good enough about my father or my mother or my husband or my brother? Like, all of what you do to honor them is what matters. And those posts, what are they really doing? They're not serving you. Like, if you don't feel good about them, you can always choose not to.
What are part of your techniques for your clients when they are dealing with grief and death after they've gone through, you know, the caregiving journey?
Yeah, I love taking people on like a meditative journey. I was just doing that with a client this morning. Her parents are alive, but what was very helpful, it's like when you feel a little bit like you're stressed out or you're overwhelmed by something that you can't control. It's like go back to a happy memory of that person And I take them through that journey. If they told me something about their father and like how much they loved, for me and my father, it was watching the Packer game, right? So just kind of taking them on that journey and what it felt like in the moment, how he made you feel, what that experience was like for both of you, and like take them on that journey. So just try and think back to a memory of that loved one, and embrace it, and then keep that feeling with you whenever you feel overwhelmed. That's something I love to do with my clients.
Now, how do you suggest that people do that on their own, right? Like, what are some actionable strategies that people can take on themselves that they won't necessarily need a coach for or someone else for, that they could really work on as daily practice, maybe?
Yeah. So get into a groove, like find a spot or a sanctuary place that you really enjoy going to that relaxes you. So it could be the corner of your room if it's really chilly outside, with a nice warm cup of tea, just sitting on a cushion, or it could be outside in a balcony looking at the water. Like, find your place that really calms your nervous system down. Start there. And then if it's hard for you to go there, find music that really soothes you, something that's calming, maybe something without words though, so you can really focus in on that moment. Otherwise, start just simply by breathing, counting your breaths to get your system to quiet down, and then take yourself kind of on a memory journey. If one memory is not working for you like you thought, try something different. Try a different memory. So it just starts by putting yourself in a relaxing setting.
Now, you had talked about it wasn't necessarily regret, right? But just like reflecting on your journey, some things that you would have done differently. How about we reflect on your journey about all the things that are, in addition to like watching the Packers games with your dad, what are some other things about your journey with your father in those few months that just, looking back, bring you joy, that you're like, yeah, we did this right. This will always stay with me.
So I would say there were two moments that really brought me the most joy. And one of them was actually seeing my dad in his element. So he had a bunch of coworkers come in that, like, I knew how well liked he was at his company, but I had no idea how he could get everyone in stitches. Like, they were all laughing at his jokes, and the conversation was just easy breezy, and you would have never even known that he was sick, right? And just having that memory of kind of being an outsider looking in was something that surprised me, because he was always the quiet observer when he would be out with like my family friends, or with my mom's friends. And when he was like in his element, though, he was just, the life of the party. And that was really cool for me to see. It was a different side that I didn't know, because you don't see that all the time. Another moment for me was I created for Valentine's Day. It was a compilation of my mom and dad and their love and my love for them. And it was just like kind of a picture book that I did it from Walgreens. I just
Oh, I
created
love
this,
that.
and it was good for myself. It was like I kind of needed it to kind of go through, my dad when I was little, and my dad when I was older, and all of the experiences we had together, and also like seeing my mom in a happy light too after this hard couple of months. And so I gifted it to him, and I just saw like, well, he cried, but also just this biggest smile that I hadn't seen for those couple of months. And I took the time to make him something special for Valentine's Day. Because every year he would give me a stuffed teddy bear. That was his thing. And didn't matter how old I was. And so I wanted to give him back something that was special and meaningful, and that really, really brought tears to his eyes and some joy during that time.
That's great. And I feel like parents will never, they will never stop doing things no matter how old you are. I know I'm a parent myself and my son's only 8, but I know at 35, I'm going to be doing the same things like that I do now that he's probably going to hate at that age. But what I did want to ask though is how have you changed since since your father's passed, like through the journey? How has the journey changed you, then and into now?
Yeah. It was very, I will say, like around our wedding time, it was very difficult because I just missed him and wished he would be there. And I just had to keep on, bringing Stan into the picture. I had to keep bringing my dad into the picture. And, but it, it was hard for me through the journey because I also connected because I saw a lot of myself in him. Like I was an emotional eater. There were definitely things I was noticing about myself throughout the years, and something like him and I would never really talk about. But when I made that connection after his passing, I was like, I need to take charge because I don't want this to be a problem, a chronic disease for me in the future. And so I had to take some action for my own health. And that was something afterwards and I know that he would have been really happy to see that looking back, that I was able to conquer it and make those changes. And I think I've also probably become more of a understanding person. I'm able to not be as reactive in a lot of ways, and kind of can see both sides of an issue. So if someone is seeing something as yellow, I might see something as purple, like, and that's going to be helpful for me in the long run. So those are probably the major things I've noticed.
Now, how has your age played into this? You're a caregiver as a young adult. How was that experience? And do you think your age influenced the way you caregive? Like when you think about it compared to your mom, how did age play a role?
I was a little resentful that I was losing my dad. He was only 60. I was 27. And so I was a little mad about it. So I don't know. Like, yeah, that's really tough. Trying to think. I'd say now if it would happen, I probably would have been like, you know what, work doesn't matter. And I probably would have just gone and driven to Wisconsin and figured it out and stayed there with him through the whole journey. That probably would have been the major shift based on my age. Because when I was 27, 26, I really couldn't. I was training from morning to night, and there wasn't virtual training really back then.
Yeah.
It wasn't an easy thing that I could do. So that would probably be the main thing, is I would have shifted and just gone back, if I were older, probably.
Yeah. Yeah. So from what I'm getting is that like when you're younger, there's a different perspective there, right? Like I think you're still in the space of, things work out, things, you have more time left. So, the immediacy is not as, at least that's what I'm hearing from this. Like there's that,
Yeah, well, I think also just different circumstances, when I'm 35 and I have a bit more financial capital, it would be easier for me to be like, yeah, I can take off this time and really focus on the care and give my mom some time off. But when I was 27, I was like still in the thick of it, and I was single too, so it's just me, one income, trying to make ends meet. I'm trying to figure it all out. And I was like, I just don't know if I can take a week off, or even with
Yeah.
all of my clients and friends that were helping out, I just knew I had to only go on the weekends, because realistically, like, that's all I could afford for that
Yeah.
age.
Now, how was it, what's interesting here is that, you had your mom and then you had you, right? And so you had a child, and you also had the partner and the spouse. What is different between the two? Like what are the differences, rather, right, between being a caregiver who's a child of the person, versus being their partner and the spouse? What are some differences that you noticed?
Well, yeah, I feel it's a balancing act as a child, because you don't want to overstep. Like, and also they wanted, like, my dad still wanted to be my parent. He
Yeah.
didn't want me to shift gears and tell him, like, hey, I think you need to do this. I had to at times, but it started me going to my mom first, like, hey, what do you think on this matter about his care plan? I just want to hear from you. Like, I always was the one asking questions.
Mm.
And I feel like as an adult, like, they kind of had to make the decisions, if that makes sense.
Yeah, that does make sense. And how did you, I mean, beyond asking questions and going to your mom, did that change over time? I know it was such a short period from diagnosis to his passing, but within that time, did you see a shift in yourself where you moved for more from that child role to that, more assertive, if you will? That might not be the right word, but more assertive in showing care.
I think it actually showed up after my dad's passing.
Oh,
So,
okay.
yeah. So for me, when my dad, the week until the week before he passed away, he made all the decisions, because I did not want, that was something I could tell was really weighing on him.
Mm,
And I didn't want to take his power.
that makes, yeah.
That was his, that's just how my dad was. And, I totally understand that. And same thing with my mom. Like, I wanted her to still be in charge and make the decisions she felt was needed. I would just ask questions and then give my feedback, if, like, about the will, for example.
Yeah.
But when it came to the decision making, unless my mom, like, really needed assistance and she didn't know what to do, I made her make the first choice. And then if she needed assistance, then I was there. And then I'd say afterwards, because I'm an only child, you kind of become more of an adult,
Mm,
because you dealt through all of that. You saw what happened. And it also made me realize, like, I might have to eventually, help out mom a little bit more, because it's just one of me. So
yeah.
that's where that comes in.
Yeah. And that is such a great just self-awareness and awareness of the people around you. Like, that you were able to see what your mom needed and what your dad needed. And you really put yourselves in their shoes to be able to give them what they want while you still were there for support. I think that's just beautiful. And from that, like, what advice would you give to other, both young adult caregivers, and also, caregivers who happen to be the child of the person they're caring for?
Yeah. Again, I think, like, listening to what the patient wants is the biggest thing, because I, there were certain things I would have done differently, but my dad really was like, no, I want to, like, stay at this hospital, because he felt comfortable there. I'm like, I want to get you to this hospital because they might have a clinical study. Like, I have to respect his wishes too, to some extent. So just listening to the patient, I feel, is really important as a child, but still don't be afraid to share the other things that you've discovered or found, or ways that you can help, because they will notice, and they'll be receptive to it, but they all make the ultimate decision for their care. So that's that, I think, for a child. And then for someone that's more of a young adult, that, are maybe they're afraid because they have the job that they have one paycheck, and they're worried
Yeah.
about taking time off. Just be mindful of the time that you get with that person then.
Yeah.
Because even though, like I said, if I was a different age, I probably would have done something different. But what I am proud of myself for doing was making the time to talk to my father, making the time to go see him, to share funny stories, to learn something about him that I might have not known, to see him in his element. All these things like really add up. And then your soul, your cup will be filled going forward. So,
Well, thank you. Before I let you go, because we are coming up to time, is there anything that you wanted to add that maybe I didn't get to touch on, something that's really important to this conversation that our listeners should know?
you've really covered a lot. So, thank you so much. I would just say the one thing to not forget about on this journey, kind of bringing it back to that soul piece, is yourself, and knowing that you can make decisions about yourself. You're always in control of yourself, even if you feel like this time is so uncertain. So if the world is blowing up, like, still come back to yourself and ask yourself, do I need that self-care right now? Can I find something that will make me smile? Do I need to understand a little more something so I have the emotional intelligence to communicate better with my loved one? And am I giving myself enough sleep? How's my lifestyle doing? Am I moving my body? Just be aware of what's going on in you.
You have taught me so much in this last hour, honestly. Like, I think a lot of us as survivors and patients, I think we need to be a bit more conscious of the people around us who are taking care of us, and need to do a better job communicating and being there. And so thank you. I'm sure I'm not the only one who's taken a lot away from this. So thank you for everything that you're doing for caregivers, for their loved ones, and, keeping your father's memory alive through the work that you're doing. Just thank you for everything and for opening up to us and our listeners.
Thank you for having me on. I appreciate it.
Of course.
We hope you enjoyed this episode of Kidney Cancer Unfiltered, brought to you by the Kidney Cancer Association. Please subscribe wherever you listen to podcasts to get episodes weekly. And if you like the show, we'd love it if you left a review. It really helps others find us. Thanks again for listening. For more information about kidney cancer, visit the Kidney Cancer Association online at kidneycancer.org.